Is it heat or ice usually better if you feel like you pull a muscle?
It's an awesome question.
Or do they not?
It depends, but I swear I get that question all the time. And you know when I get the question? People call me in the shower. They literally call me in the shower. That's when they call me. They're like, Doc, I might even know them, so they're kind of comfortable with me. Doc, I'm in the shower, I can't move. I'm putting hot, I've been in here for a half an hour and I can't move, right? And let's say, for example, you injure yourself. You ever sprain an ankle? Anyone ever sprain an ankle? It swells. So the arteries are enlarging so the inflammation can get to the area. And the purpose of the inflammation is two things. It's to act as a protective mechanism so that you say, you know what, this is injured, don't move. The other thing that it's doing is that it's bringing nutrients to the area so that you can start repairing. But little do people know, after the age of 25, those nutrients repair scar tissue versus before 25, they repair as normal tissue. That's a big problem. That's why we don't heal the way we used to heal. What happened? I used to be able to do this, well, the body changes. So the question, going back to heat or ice, is if something, so the body overreacts, so it's not perfect. So it keeps the swelling there. When it does too much of it sometimes, and it does it for too long. So if it's swollen and it's acute, which means it's within the first few days or weeks, you really can't go wrong with ice, okay? And you want to do ice for about 15 to 20 minutes, and you don't want to do it any longer than that. And people think, oh, I just slept with the heating pack on, or I slept with the ice pack on. No, because if you use ice and you use it for longer than a period of like 15, 20 minutes, you have the potential risk of it doing the exact opposite of what you want. It actually can reverse the scenario and cause increased swelling in the arterial arteries to actually expand. And that's not what you want. With ice, you want it to contract so that it stops the swelling. Now, if you just have everyday aches and pains and you're just on the job site and you're getting home and you're just kind of a little bit sore, it's a toss-up. Heat usually works better. And you want to do that for 15, 20 minutes. And you want to use moist heat, wet heat versus dry heat generally. So what's dry heat? Those electric heating pads that you get, that's a dry heat. A wet heat would be shower, bath, where they actually have these hydrocolators where you can put the pads into it and they're wet and they actually absorb faster and work better and get deeper into the muscles. And again, that's 15, 20 minutes. The best thing that people can do, oftentimes, if you're not sure, is you do ice, heat, then ice. So you get a combination. So you contract the blood vessels, then you use heat and it relaxes it, then you contract it again. But you want to begin with ice, you want to end with ice, because that's always, ice is usually safe. For acute injuries that's just happen fast, generally ice. If it's a chronic thing that's just like an everyday ache and pain, usually people like heat more. So, and again, when we speak with you, we'll kind of be able to gauge, what's better for you depending on the situation. Every situation is different. But a lot of people put heat on. Here's an example. A guy says, yeah, I hurt my back, I couldn't get out of bed, and I couldn't go to work, so I put heat on it all day, right? And he goes, I woke up and I'm feeling worse. And then he literally can't get out of bed. So, he should never have put heat on it, because he just caused inflammation to be more inflammation. So you have to know when to use it right. If I'm walking right here now and all of a sudden I just twist over and roll my ankle and it starts swelling, it's ice. You don't want to use heat. If I'm just like going home tonight and I'm like, if I'm standing up here, I just don't feel that great, I use heat. If you go to therapy, usually they'll use heat on you in most cases, so you can loosen the muscles up so we can get in there and do deep tissue massage and stretching. And then afterwards we'll use ice to calm down the inflammation from the work that we did on you.